Did you know that 1 in 8 women will be diagnosed with breast cancer in her lifetime? But here's the shocker, men can get it too. Breast cancer doesn't discriminate by gender. It could happen to you, your sister, your mother, or even your father. Stay with me till the end because what you will learn in this video could save a life. Breast cancer occurs when cells in the breast grow uncontrollably, forming a lump or tumor. This tumor can start in different parts of the breast, but most commonly in the ducts or glands that produce milk. Breast cancer can spread to other parts of the body if not detected early, so knowing the signs is crucial. Though it's more common in women, men can also develop breast cancer because both men and women have breast tissue. Early detection is key, and today we will dive into everything you need to know from symptoms and risk factors to prevention and treatment options. Let's break down the symptoms for both women and men because early detection saves lives. For women, common signs include a lump in the breast or underarm, changes in the size or shape of the breast, dimpling or puckering of the skin resembling an orange peel, nipple discharge, especially if it's bloody, inverted nipples or persistent nipple pain, swelling or redness in the breast. For men, the symptoms may be less obvious but still crucial to watch for. A lump or swelling, usually painless in the breast. Nipple retraction, that is when the nipple turns inward. Nipple discharge or bleeding. Skin changes around the breast or nipple, such as redness, scaling, or dumpling. Certain factors increases the risk of developing breast cancer, and it's important to be aware of them for both men and women. For women, the risk factors include age. The risk increases as you get older, especially after 50. Family history. A close relative with breast cancer significantly increases your risk. Genetics. Mutations in genes like BRCA1 and BRCA2 raise the risk substantially. Hormone exposure. Long-term exposure to estrogen through hormone therapy or early menstruation can contribute to the risk. Lifestyle choices. A diet high in fat, lack of physical activity, smoking, and excessive alcohol consumption increases the risk. For men, risk factors are slightly different but equally important. Genetics. Men can carry BRCA gene mutations, increasing their risk. Radiation exposure. Previous radiation treatment, especially in the chest area. Hormonal imbalance. Elevated estrogen levels, such as from a liver disease or hormone treatment. Family history. A family history of breast cancer also increases the risk in men. Early detection truly saves lives and it applies to both men and women. Here's what you need to do. For women, perform monthly breast self exams to feel for any changes. Women aged 40 and above should get regular mammograms every 1 to 2 years. Younger women should have a clinical breast exams at least every 3 years. For men, beware of changes in your breast tissue. Even though it's less common in men, if you feel a lump or notice skin changes, consult your health practitioner right away. Awareness is key for both genders. Why is this so important? Detecting breast cancer at an early stage, like stage 0 or stage 1, dramatically increases the chances of successful treatment. If left undetected, it can spread to other parts of the body, making it harder to treat. Now, let's talk about the stages and types of breast cancer. Breast cancer isn't a one size fits all disease. There are different types and stages, which determines the treatment plan and outlook. Ductal carcinoma in situ, DCIS. This is an early form of cancer where the cells are confined to the duct. It hasn't spread, so it's highly treatable. Invasive ductal carcinoma, IDC. This is the most common type and occurs when the cancer cells have spread beyond the duct into the surrounding breast tissue. The staging of breast cancer ranges from stage 0, where the cancer is non invasive, to stage 4, where the cancer has spread to other parts of the body, known as metastatic breast cancer. The earlier the stage, the better the chances of successful treatment. Treatment for breast cancer depends on the type, stage, and other factors unique to each patient. Here are some common treatment options. Surgery, often the first step, aiming to remove the tumor or the entire breast, known as mastectomy, if necessary. Radiation therapy. This uses high energy rays to kill cancer cells left behind after surgery. Chemotherapy. Drugs are used to destroy cancer cells, especially if the cancer has spread. Hormone therapy. This is used if the cancer is hormone receptor positive to block the estrogen and slow the cancer growth. Targeted biological therapy such as trastuzumab for HER2 positive breast cancer. Every patient's treatment is personalized, and it's vital to consult with a specialist to understand the best path forward. Whilst you can't change certain risk factors like genetics, there are ways to reduce your risk for developing breast cancer. Regular exercise. Physical activity helps lower the risk for both men and women. Eat a healthy diet. Focus on fruits, vegetables, whole grains, and lean proteins and avoid processed foods. Limit alcohol consumption. Excessive drinking increases the risk for both men and women. If you can stop, it is even better. Quit smoking. Tobacco use is linked to various cancers, including breast cancer. Breastfeeding. For women, breastfeeding can slightly reduce the risk of breast cancer. Knowing your family history is also important. If you are at a higher risk, you may need earlier or more frequent screening. Breast cancer awareness isn't just for women. Men, you are not immune. Knowing the signs and understanding the risk can be life saving for everyone. If you notice anything unusual, whether you are a male or a female, consult your doctor right away. Early detection could be the difference between life and death. If you found this video helpful, make sure to like, subscribe, and leave a comment with your thoughts or questions. Don't forget to follow all our social media handles for more health and wellness tips. And be sure to check the link in the description to read my detailed blog post on breast cancer, where I cover even more tips and advice. Share this video with someone you truly care about because raising awareness could be the first step towards saving a life. Let's fight breast cancer together for women, for men, for everyone.